everyone. My name is Sadvi from I'm an undergraduate student and I'm from the Nilkanga Ayurvedic Medical College, Yerbagh, Basukalyan district and the Karnataka. So let's begin to my topic is that case study related to the Amla Pitta in the Ayurveda view on the basis of Samanya Guna Vishesha Siddhanta. So before coming to the main topic, we will just give a brief glance about the what is Ayurveda, what is Samanya Vishesha Siddhanta, and then what is the Amla Pitta disease actually. So Ayurveda is the one which gives the brief information of every aspect of the human being or else any substances. So Ayurveda is the one which tells about the past history to the till present history, what are the aspects that has been described or else told by our acharyas. So for example, the Samanya Vishesha Siddhanta, which is led by the acharyas before the long years ago, and still we are following in present era. That is one of the that is because of the Ayurveda. That's what the Ayurveda is meant for. So coming to the Samanya Vishesha Siddhanta, Samanya is the Sarvada Sarva Bhavana, Samanyam Vrittikaram, Rasa Hetu Vishesha, Ubhayasatu Vishesha. So this is the Samanya Vishesha Nirukti. So what is Samanya? Samanya, it means the similarity or the vruddhi of any substance, and the ras is the qualities which reduces the substances is called Vishesha. So it also the important that these are the combination for any of the substances to reduce or to increase it. So it has both the Samanya and Vishesha has three types, like Samanya Vishesha, Guna Vishesha, Dravya Vishesha, Guna Vishesha and Karma Vishesha. And also in the similar way, Samanya has Dravya Samanya, Guna Samanya and Karma Samanya. So Dravya Samanya is like the generality or the similar between one or more substances. And the Guna Samanya is the here the Jati type is similar to the Samanya, means like for example like ghee and milk has a similar property for the Shukra Dhatu. So Karma Samanya is like the if the Dravya and the Guna is not similar but the action belongs to the same result, so it is on the Karma Samanya, and it is also similar in the Vishesha on Vishesha, that is Karma Vishesha. So let's get to the following topic. What is the difference in between those two, Samanya and Vishesha? Samanya is means the general and Vishesha is means the particular, where there is the sense of oneness in the Samanya and there is sense of separation in the Vishesha. For example, if there is if a substance like Medha and Asti are the two substances, and a person suffering from Medha Dhatu will be given the line of treatment according to the Medha Dhatu itself. And in the if Vishesha is for example like Vata Vriddhi is, then when what we used is Thailya we use for Thailya we use, right? So these are the Samanya Vishesha differences. So let's come to the our topic, that is Amla Pitta. Amla Pitta, what is Amla Pitta? Amlam cha iti amla guno draviktam pittam. So what it means that the qualities which has this soreness because of the Pitta leads to the Amla Pitta. So it also the nidhanas are like Ati Guru, Ati Bhojana, Ati Guru Bhojana, Ati Snigdha Bhojana, Ati Ushna Ahara, Abhishyanda Ahara, Viruddha Ahara, Vidagdha Ahara, and Ati Tikshna Ahara. These are the qualities, these are the causative factors which causes the Amla Pitta. Amla Pitta is nothing but the hyperacidity according to the modern aspect of. So hyperacidity is nowadays the common disease found all over the individual because of their unawareness about their Prakriti, which can lead to the Amla. So what are the types of Amla Pitta? That there are, according to Kashyapa Acharya, he said the three types on the basis of the Vataja, Pittaja and Kaphaja. According to the Bhavapakasha and Yogaratnakara, there are two types, that is Urdhva Amla Pitta and Adhoga Amla Pitta. The Samanya Lakshana, that is the symptoms which causes the Amla Pitta, are the like Antrakujana, Annada Klama, Hridayadaha, Hridayashula, Udarashula, Shramha, Kantadaha, Aruchi. These are the Samanya Lakshana. If there is an Urdhva Amla Pitta, it leads to Urdhva Amla Pitta. Lakshanas are like Bhukteva Vami in Tikta Udghara, Amla Udghara, Bhukte, Charana, Daha, then Jwara. These are the Urdhva Amla Pitta symptoms. Ushnata is the Urdhva Amla symptoms. Adhoga Amla symptoms is like Ullasa, then what we can say is like Kandu, Daha, Trishna, Anna, Dvesha. These are the Adhoga Amla Pitta symptoms. So let come to the Samprapti of the Amla Pitta. When we take the Nidhana Sevana, like we said in the uh, before some before video, like we say Nidhana, what are the Nidhana Sevanas of Amla Pitta is like Vishandhyahara, Viruddhahara, Ajirna, Vipakvahara. These are the Nidhana Sevanas. If we take those ahara, then what we in there will be like aggravation of pitta. When there will be the aggravation of pitta, there will be the agni manda in the form of tikshna agni. When there will be the agni manda, obviously it will lead to the vidagdha ahara, ajirna. So when there will be the vidagdha ahara ajirna, there it will form the soreness, which gives the fermentation of ama, production of ama, and production of amla pitta. So this is what the samprapti of amla pitta. Where there will be vidagdha, there will be the soreness produced. So that's what it causes the amla pitta. Then what we give the line of treatment is that like there will be shamana shodhana chikitsa, like shodhana means langana brahmana therapy. Shamana means like the substances that suppresses the amla pitta, and we give the panchakarma therapy, like basti, Raktamokshana, Vamana Virechana. Virechana is the second line of treatment. So there was a case study of Adhoga Amlaga Pitta, a person of 64 years age. He came with a complaint that there is epigastric pain, abdominal distension, and pain in the throat and the chest region. So when we assessed him, the past history of him was like from 1 month he was associated pain of him was like from 1 month he was suffering from backache, and there was a burning micturition. While he was micturating the urine, there was a burning sensation. So the medical history, there was no surgical history found. Past history was like no any thyroid and allergic illness, and family history was like there is disturbed and stress, and his personal history was he was taking recurrent spicy food, and there was a burning sensation and disturbed sleep, and there was a stress. So when we assessed him, the clinical examination, uh, every vital points like BP was normal, everything was normal. Ashtavida pariksha on the basis of Ayurveda we done was like mala was a samyaka, that is hard and sticky stools, and mutra was a burning sensation while mutra. Then his sound was irritating, his jiva was like alpasama, and his drukha was like somewhat clear, and his prakriti was madhyama. So when we assessed him, we when we diagnosed him, we found that there was an adhoga amla pitta disease. So when we started treating him by giving an panchakarma therapy like sasneha swedha, patrapinda swedha, basti, like tikshna nasya karma, then and again medications we gave him like gandhara vati, rasnadi kwata, and the churna. When we gave him, then we found that the symptoms which he complained at the earlier stage were reduced by the by very reduced. The patient symptoms were reduced by the half. Like he was not suffering from the udarashula, he was not suffering from the shrama, he was not suffering from the klama, also he was not having an ushnata in his body when we given these all medications. So in the end I wanted to tell you is that the Samanya Vishesha Siddhanta is the combination that works on in the line of treatment of every diseases. So Samanya Vishesha Siddhanta in Amla Pitta was like Pitta Shamak and Vatanulomana effects. So this is to tell in the end that without any Siddhanta of Samanya Vishesha, we cannot treat any diseases, because these are the most important Siddhanta on the line of treatment. Because when there will be any decrease in individual, or any increase in individual, Samanya Vishesha is the most major siddhanta which plays an important role of every line of treatment. So we cannot tell that without Samanya Vishesha Siddhanta we can treat. No, it's a wrong statement. So in the end, I can conclude that my Amla Pitta disease of an case study on that 64 years old male patient was done on by the Samanya Vishesha Siddhanta, which proved that there is a line of treatment on the Samanya Vishesha Siddhanta itself. Thank you so much.